Good afternoon, everyone. We'll give people 1 or 2 more minutes as they filter in from the waiting room, and then we can get going. All right. So yes, let's begin. Hi, everyone. My name is Liz Sutherland. I'm the Associate Vice President of Housing Services at the YMCA of the National Capital Region here in Ottawa, joining you from the Eastern Time Zone. So it's 1:45 here. Kathleen, can I ask you to introduce yourself?
Yeah, my name is Kathleen Holloway-John. I'm the Associate Vice President of Newcomer Services at the Y of the National Capital Region, and I work with Liz and Belinda, who's going to introduce herself in a second, on the program that we're going to be talking about today.
Thank you. Over to you, Belinda.
And yes, I'm Belinda Bordoff. I'm the manager of Transitional Housing Services here at the YMCA. I've been working here for 10 years and spent over 25 years, a long career in housing and homelessness sectors. So thank you for having us.
Thanks, Belinda. And we're joined today by Dr. Yvonne Su, who's going to be our discussant for the session. Yvonne, would you like to introduce yourself?
Sure. I'm an associate professor at York University in the Department of Human Rights and Equity Studies, and I'm a visiting scientist at Harvard's T.H. Chan School of Public Health, and I study forced migration studies.
So a perfect choice for a discussant on this panel. Thank you for joining us today. Okay, I'm going to be sharing my screen for a presentation that Belinda and Kathleen are going to be doing together. We're going to make sure we leave lots of time for both Yvonne's questions as well as any discussion that comes from the floor. We do want this to be interactive, so feel free to raise your hand if you have a question, save it till the end, and we can make this nice and informal if that works for people. And with that, I will share my screen, which is so easy in Zoom. I do love Zoom. There we go. Can you folks see that okay? Okay, great. All right. So I'll start and then we can hand things over. So our presentation is called All Under One Roof, which is a reference to all the supports that we provide to our residents that are essentially on site from the Y. So we'll get into the details of that, but that's why we called it All Under One Roof. Most of you know what the YMCA is, but just for context, our YMCA has been providing services in Ottawa and Gatineau for over 150 years. We have services in a full range of community services: housing, childcare, employment and newcomer services, children's programs, youth services, and fitness and aquatics, the classic gym and swim that many of you grew up with at the Y. This is our building here in Centertown, Ottawa. Our mission is to contribute to a vibrant and inclusive community by providing individuals with equitable access to the services, supports, and the opportunities they need to thrive. Our values, which are core to all of what we do, are excellence, compassion, dignity, accountability, and inclusion. So YMCA Housing Services, for those of you who live in other cities and know YMCAs, not all of them have housing services, of course. Ours has a housing tower that has 250 people living there, and it's individual youth and adults who are at risk of homelessness. So we provide transitional and supportive housing to people who are at risk of homelessness, including newcomers to Canada primarily, and those who live with physical, mental, and/or substance use health challenges. And with that, I'm going to hand it over to Belinda, who's going to tell you a bit more about our housing programs.
Hi, yes. Can everybody hear me okay? Okay,
That's
perfect.
Great, yes.
So as Liz mentioned, we have a tower of over 250 residents. So in our tower, we have, as it's identified on the screen, 3 different housing programs. We have a second stage housing program for youth, which is transitional supportive program for 17 youth between the ages of 16 and 24 who are unable to live at home or would otherwise be homeless or at risk of being homeless. The youth in this program must be involved in full-time day program, whether that's school, employment, volunteering, treatment, or a combination of these. And each youth has an individualized goal plan. They all participate in life skills workshops and social activities to help prepare them for successful independent living. There is an application and assessment process for this program, and there is a wait list. Secondly, we have our supportive housing programs, which house 80 adults. And as the name suggests, many need some sort of support to live independently. The two branches of the supportive housing program have 32 residents in the monthly housing program. And these are more long-term tenancies. Some residents have actually called the Y their home for over 25 years. And then we have another 48 residents in our TRI program, which is therapeutic rehabilitation at the Y. Residents in supportive housing may be living with mental health and or addictions challenges, aging in place, or would otherwise be homeless or isolated with no sense of community. So there's an application and assessment process also for this program, and they do operate on a wait list too. Finally, our largest program, which is the program I manage, is the transitional housing program. So at our current capacity, we provide transitional housing to over 175 adult newcomers who share rooms. It's 2 to 3 people to a room on gender-specific floors. We have 2 floors for women and 3 floors for men. So some people do say that housing first means we should only focus on permanent housing. But in such a difficult housing market, newcomers to Canada benefit from transitional housing while they are waiting for their residency paperwork, finding work, and integrating into our community. They're expected to stay in our transitional housing program for approximately 12 months while they get settled, taking language classes, skills or job training, finding employment, and then moving on to permanent housing. One thing I should say about all of our programs is every program does have fully equipped kitchens and laundry on site. So everything that somebody would need in an apartment is basically within our housing floors. So I'll move on to the next slide, which is who do we serve? So as you can see, it's pretty self-evident. The majority of our residents across all of our programs are refugee claimants, around 72%. And the majority of them are coming from African countries. Canadian citizens do make up a small portion of our residents, and they are primarily in the longer term monthly supportive program. And we have all ages here, anywhere from the ages of 18 all the way up to 70. So we have a very diverse group of residents in our housing programs. I'll move on to the next slide, please. So how do we work with the City of Ottawa? So I'm going to refer to the City of Ottawa as the city. It's just a mouthful otherwise. So we have a very strong and trusted partnership with the city. They are our primary funder, but they also determine and review our licensing requirements. Up until late 2024, we housed approximately 50 families in our emergency family shelter, and those families would range in size from 2 to 12 people per family. The City of Ottawa's housing branch would assess and refer the families to our program. With the changing trends and shifting needs, we responded to the city's request and agreed to convert our family shelter to a transitional program for individuals, with the focus being on the newcomer population. We worked diligently with the city to move all the families out of the Y into their own recently opened family program so that we could prepare to welcome over 150 single newcomer adults into our housing programs. Fast forward to the middle of this year, 2025, with the closure of IRCC-funded hotels, the current housing market in Ottawa, and of course other factors, the need for spaces for families increased. So again, in partnership with the City of Ottawa, we are retrofitting 4 other floors in our tower that you saw in the earlier slide to accommodate up to 67 newcomer families. So we'll have single individuals and families in our building as of next year. We're definitely excited to be welcoming families back, where they will receive the same wraparound services that our single residents do, but they'll also have access to on-site childcare and camps, which is great for the families. So we continue to meet regularly with the staff from the city to assess the emerging trends and see how we can help meet any current needs. So why did the city approach the YMCA for transitional housing program? So for the past few years, as we all know, there's been a rapid growth of newcomers to Canada, obviously to Ottawa as well. Much of this is related to a number of factors. People are often landing in Montreal or Toronto and then moving to Ottawa. People enjoy like the idea of coming to Ottawa as a welcoming city because it is bilingual. A number of different factors, including the current situation that we see in the US. So a housing crisis was declared in the City of Ottawa in 2020. And during the pandemic, spaces were needed so that the overcrowded community shelters could practice physical distancing. City of Ottawa community and recreation facilities were turned into what were called physical distancing centers. And I don't know if any of your cities, if you had anything like that, but this was a way to help prevent the spread of COVID, obviously, by providing a safer distancing area for people. With the increasing numbers of the homeless individuals in the city, post-pandemic, the distancing centers remained open primarily to accommodate the solo newcomers that were coming into the city of Ottawa. Obviously, the communities, the neighborhoods wanted their their community and recreation centers back. So a longer term solution was needed. And that's where we come into play. So we were approached by the city of Ottawa to convert as we said, our family shelter into transitional housing for singles. So the first phase was to move as many newcomers out of the physical distancing centers into transitional housing programs such as the YMCA. And then phase 2 was to remove once the distancing centers closed, anybody that was left in the shelter system that fit the newcomer criteria was also considered for move to a transitional housing program. So the ultimate goal for those in transitional housing is to move into private market units rather than waiting for a subsidized housing offer. So whereas when we had families, they would typically stay in our programs for up to 1 to 3 years waiting for their subsidized housing offer. Whereas with the single adults, it can be 5 to 10 years to wait for subsidized housing, rent geared to income. So we had to think outside of the box, looking at alternate housing options, as the expectation would be for individuals to find housing within 12 months upon their arrival. How would we be able to do this? Again, because we offer those wraparound services, we already have a robust newcomer and employment service program. It was a perfect fit. So our wraparound services. Does anybody, I'll just go a little bit into how people end up in our program. So those eligible for our transitional housing program must be staying at one of the 4 identified community shelters in the city of Ottawa, and they have to be referred to us by a shelter caseworker. We would then assess those applicants for suitability for the program and then schedule a move-in date if they are accepted. This process can generally take 2 to 10 days based on bed availability, based on maybe their work schedules or whatnot. We cannot accept walk-ins or self-referrals. And in these cases, any individuals would be redirected back to the community shelters where the caseworkers there could determine if a referral to our program would be appropriate. On the day of move-in, a resident is welcomed by their assigned case manager and they complete their intake and orientation. The case manager explains the rules and expectations of the program. They're provided with a tour of their respective floors and the common areas and are provided with a starter kit, which includes the basics such as bedding, dishes, and all that's needed to cook and clean with. Appointments are made for the new resident to meet with staff from the newcomer and employment services programs, which Kathleen will discuss a little bit later, so I won't go into details about those services. During their stay, residents are expected to meet with their case management team on a regular basis and participate in various life skills workshops, which include topics like living with a roommate, banking in Canada, and budgeting, as well as practical things like how to use a microwave and how to navigate the public transit system. All things that we may take for granted, but somebody who's new to the country may not be familiar with. All residents receive a free membership to our health, fitness, and aquatics facilities, which gives them access to a full gym, sports courts, fitness classes, and a pool. So we're looking after the full wellness, mental health, physical health, and everything in between. We have a strong partnership with the Centertown Community Health Center, which is our catchment area's community health center, and with Ottawa Public Health. And this gives residents access to a nurse, to free vaccine clinics, and to health information. One of the most important elements of our wraparound services is creating social connections. Our staff take residents on outings to help create a sense of community and build connections. Activities include things like bingo or attending OHL hockey games and bus tours of the city. Actually, you'll see a picture on one of the upcoming slides is a picture of our bus tour, which was so much loved by all the residents. They couldn't stop talking about it for days. We've created a monthly event called Coffee and Connections, which gives staff and residents an opportunity to mingle in a familiar setting. I'm not sure if anyone follows the Canadian Premium League of Soccer, but a number of our staff and residents attended the final Atletico Ottawa match a few weeks ago, which was actually played in a snowstorm. So that was a real welcome, a real Canadian welcome for a number of our residents who had never experienced snow before. So all of these wraparound supports play an integral part in making our program the success that it is. And of course, this can't be done without our great team of staff. So our transitional housing team consists of supervisors, case managers, and housing support workers, as well as the staff from the Newcomer Employment Services. Case management is available 7 days a week, with each case manager having specific office hours, some working day shifts, some working evenings, and some working weekends, so that we can be there for the residents who live in our programs. They don't all have the same schedule. So some people are working during the day. We need to be able to provide services in the evenings. So we try to cater to all those needs. Each case manager has approximately 20 residents on their caseload, and the case managers work in teams of 2 to ensure that as much consistent support is available, even over staffing gaps when somebody's off sick or someone's on vacation. And as mentioned previously, we do collaborate really well with the newcomer staff, which, as I mentioned, Kathleen will go into a little later. I don't want to repeat what she's going to say. So we also have housing support workers who offer 24/7 coverage, 365 days a year, working out of a dedicated office that's accessible to all residents, not just residents in our transitional housing program, but residents to all of our housing programs. They can assist with intakes, provide crisis intervention, and offer support when case managers are not on site. And we also have our own in-house security to help ensure a safe space for all. As we are a City of Ottawa licensed program, one of our requirements is that half of our staff on each shift must be bilingual, English and French speaking. However, with our diverse staff team, we often have a staff member on site who can speak other languages too. The diversity on our team also makes it more comfortable for a number of our residents, since many of our staff have experienced the settlement journey themselves. The YMCA is a great place to work. This is evident in the fact that we have many staff that have remained at the Y for years. I mentioned earlier that I've been here 10 years. Kathleen is also, we both celebrated our 10 years recently, but we've got staff who've been with the Y for up to 40 years. We offer training opportunities to help staff achieve their career goals. Staff often advance in their careers within the Y, whether it's within the program that they start in, or they move to a different program or department. We offer a healthy pension and benefits package, and just like the residents, all of our Y employees do get a free individual HFA gym membership. So having a really loyal staff team helps us do the work that we do with less gaps in service. And that's pretty much it for our housing section. I think Kathleen is up next with newcomer services.
Yeah, so I'm going to talk a little bit about adding on to what Belinda was saying about the newcomer services. So in terms of the welcome to an intake into the program, after the initial intake into housing happens, the next step is for all of the residents to meet with one of our newcomer services staff. And at that point, they get a full needs and assets assessment, similar to what that we've developed with the housing team, that looks at a variety of aspects of the settlement process, but very focused on the needs of a refugee claimant or an asylum claimant. And from there, we work with the individual themselves to identify their goals and create a tailored settlement plan that is then shared with the housing case manager. So the resident themselves gets access to their settlement plan. It's an interactive plan that they can access. We can either print it for them, we can send it to them by email, or they can access it virtually and actually click through things, click through the links, and interact with the various resources that we've shared with them. But it also gets shared with their housing case manager, so that the housing case manager can continue to work with them on the different goals that they've set for themselves. So that's sort of step one in terms of newcomer services, and that all happens on site, and the residents don't have to leave their comfort zone in order to access those services. We also help connect them to the other newcomer services that are available, both within the Y and in the community at large, because we know we can't do everything ourselves, and there's some amazing services that are available in the community. And so our role as the Newcomer Information Center, which is one of the other newcomer services that we run in the National Capital Region, is to be a connector, not just for refugee claimants, but for newcomers in all at all parts of their journey to becoming settled in the Ottawa area. So we connect them with the Newcomer Information Center and all of our other newcomer service programs, including language assessment, our newcomer employment program, and our refugee legal orientation and support program. So with that program, one of the other things that we're able to do is actually connect them with legal support, light touch, so not a lawyer, but legal advice and connection to lawyers in the community who have expertise in the refugee process. And that is all within the Y programming. Other things that we do as part of the newcomer support that's on site is we coordinate and schedule other on-site support. So one of our roles is to coordinate the support of for employment services. We know that one of the life stabilizing supports that needs to be in place in order for people to access market housing is that people need to be employed and have a means of income outside of Ontario Works or the social supports that are available in the community. So we connect with either coordinate a connection with the Employment Ontario programs that are available in the community, or help or work with the case managers within that our residents are already working with to make sure that they're getting all the support that they can access. We sometimes bring that support on site, but what we do find is that there does need to sometimes be that push to get out into the community a little bit more and explore things. And that we're really lucky in that our residence is actually just a block and a half away from some of our other employment and newcomer services sites where there is an Employment Ontario location with 15 different case managers who can support with the employment side of things. We also coordinate other supports coming on site. So we've had Community Legal Services Ottawa come in and do presentations. We've had CRA come in, do presentations specifically focused on information that newcomers may need. We'll be looking at, as we're approaching tax season, bringing in CRA to give some information about how to file taxes for the first time. Belinda already spoke a little bit about budgeting and financial advice, really sort of tailoring the supports to feedback from our residents. So the housing case managers are meeting regularly with our residents in order to support them in their goals, and working, and as the newcomer services side of things, as we're working with the housing team, they're identifying what sort of supports might be needed, and we do our best to leverage the relationships that we have from the other programs that we run to bring in supports on site when appropriate, or connect with the supports that are already available, or virtual workshops that are already available through the community. Liz, was there anything you wanted me to add there? I could talk about this all day, but
no, I think that was a great overview. I'll move you on to the landlord relations slide if that's okay.
Mm-hmm. Oh, the other thing, I did talk a little bit about legal advice, but the other thing that we support with is applications to legal aid. If generally by the time the residents are arriving to us, they've already completed the portal application and that sort of things. But if they haven't, we're able to support with that as well.
Right. Very good.
So one thing that we noticed very early on in this program was that there was a different need in terms of support in accessing market housing. As Belinda was sort of talking about earlier, our previous transitional housing program, the exit really was into a subsidized housing program, whereas the intention with this and the expectation is with this transitional housing program is that our residents will be moving out and moving on to market housing and rentals. So we very early on, we identified a need for some support in terms of landlord relations. So we introduced a landlord relations liaison, which is a bit of a mouthful, but basically their role has been to support residents for sure, and doing a lot of the educational piece around how to organize yourself for a job, for a housing search, what things you need to have in place. We've worked on a checklist so that people know, like, even from day one that they're with us, that these are the things that they need to start working on in order to be able to access market housing at the end of the 3-6 months that they're with us. So supporting individual residents. So our landlord relations liaison meets with residents who are at that point in their journey. He'll meet with them once a week to help them search for rentals, to sort of go through that checklist, make sure they have the things in place, and make sure they feel confident in their approach. They will go with them to their first viewing, to support them, to help them understand what questions they need to ask, how to present themselves, how to put their best foot forward. But even before we get there, they're doing workshops, they're bringing in experts on tenants' rights and responsibilities, and talking about roommates, maybe looking for housing with roommates, how to navigate that. So that's on the support for resident side. We're also using this role to support the housing case managers to strengthen their knowledge base and their capacity to help navigate the market housing options. And then the final piece is actually working with landlords. So they're working with landlords to advocate for our newcomers. We know there are a lot of barriers, such as having a credit history in Canada. Often they're looking for someone to co-sign. So advocating for our newcomers to lower the barriers, to reduce the barriers that landlords are putting up, and really try to create some more opportunities for our residents to access the rental market. And it's been a learning curve, and we're still on that journey, but we've had lots of visits and lots of actual interest from the landlords that we've reached out to for more engagement and more opportunities to discuss things. So it's coming along, and we're really excited to explore this side of things a little bit more.
Mm-hmm. Super.
I think I'm going to pass it back to Belinda, or is it Liz?
I can take this one. Yeah. So I mean, that the landlord relations liaison, which is anyway, it is a mouthful. That is the first piece of what we like to think of as unblocking the pipeline from transitional to permanent housing, which is such a challenge in the context of a housing crisis. So the other two pieces that we've got as kind of special projects to address that are partnership-based projects. One is with Operation Come Home, which is a long-standing youth-serving organization in the Ottawa area. And they developed this program called Master Leasing or Head Leasing. And they essentially have, done a different form of landlord relations, whereby they enter into agreements with landlords for leasing a certain number of units, and then they place youth into these units in kind of a supported housing arrangement, where if there's any issue with rent not being paid, the organization covers it. If there's an issue with neighbor relations or garbage or what have you, then Operation Come Home has a case manager who will intervene and make sure that things get sorted out. So this master leasing program is really quite new. It's only been around for a few months. And they have reached out to other organizations like us who have youth housing programs to essentially help place them. So with our 17 youth beds, we've only been participating since the summer, but we've already placed sort of 11 or 12 youth through this program into permanent housing. And of course, the youth get to stay on in the unit after the agreement ends, and they can essentially stay as a regular tenant. So what the YMCA is interested in doing is offering this service to our graduates of transitional housing, adults of any age, so that we can build on the relations that our landlord relations liaison is developing, and essentially use the template of the master leasing program for our own transitional housing graduates and other organizations as well. So that's a second initiative we're exploring to essentially unblock the pipeline. And the third piece is a pilot project that we've got. It's in the planning stages. We're hoping to launch around July 2026. And this is a home share program. So some of you may know about Canada Home Share, which I think it started as Toronto Home Share, and they essentially connect often seniors, people living in houses with rooms, spare rooms that they are open to renting, and they match them with normally with post-secondary education students who are looking for a room to rent. And so this has happened in, I think, 5 or 6 cities across Canada. And we're looking to launch it in Ottawa. And one of the big focuses for us is going to be to serve people coming out of our transitional housing program so that we can tap into that market of spare bedrooms in Ottawa, which data shows there's about 340,000. So just think of the impact we could make if we could tap into some of those spare bedrooms and find permanent housing for the graduates of our transitional housing program, and at the same time promote intercultural dialogue, intergenerational connections, and the kind of social integration that comes with sharing a home and getting to meet your neighbors and so on, instead of just having your own private housing. So we actually have a partnership with the Council on Aging Ottawa for that, and Briere Health, a local healthcare nonprofit, which is interested in supporting on this. And so Canada Home Share is our kind of national nonprofit partner on that program. And as I say, we're looking to launch in the summer of 2026. And with that, I'm going to hand things back to Belinda to lead us on the kind of more informal part of the presentation around some of the challenges and solutions that we've been exploring in our programming. Over to you, Belinda.
Thank you, Liz. So obviously with change, there always comes challenges, right? But we take those as learning opportunities. And we've learned a lot in the last year. So our transitional housing program has really only been up and running for 13 months. In that 13 months, it's been a lot of trial and error. I would say the first major challenge we encountered was obviously having to work with a different demographic. Our staff are not used to working with specifically newcomer clients. So as Kathleen has already pointed out, we have a really robust newcomer and employment services team. So that was an easy fix. We were able to learn from them. So that was a quick one that we could address. We also have to come up with realistic solutions. So a couple of the other challenges that we have are in our transitional housing program, as I mentioned, it's shared rooms. Not everyone's going to get along. We try to match people as best as we can based on bed availability. We try to base the matches on language, age, cultural, religious beliefs, and so on, to try and make it as easy as possible for everybody. That still might not do the trick, so then we may have to have some conflict resolution, deal with some mediation and whatnot. And there are times when we do have to discharge people because they just cannot comply, cannot follow the rules. But that's our last resort. So we will move people from one room to another if it's going to make things a lot easier for everybody. When we are at full capacity, that's not always easy. It's like playing a little bit of Tetris, moving one from here to there, but we can make it work. Language barrier was mentioned earlier by Kathleen. So not all of the residents that come to us speak English or French, as I'm sure you are all familiar with. But as mentioned, because we have so much diversity on our teams, we can often provide language support in their preferred language. And if we're not able to do that, we will pay for translation services to ensure that all of our residents fully understand the requirements of the program. We also, as Kathleen mentioned, we have a language assessment center. So another solution was trying to get our residents hooked up with language assessment to improve their English or French speaking skills. One of the other challenges that we struggled with, and Kathleen can probably speak to this a little better than I can, is a lot of the residents came to us and indicated that they were taken advantage of, or there were scams or whatever it may be. So trying to navigate that, that was very new to us. I don't know if there's anything more you wanted to add to that, Kathleen, at this point, or you could just leave it
Well,
at that.
I know that our, like, in terms of drop-in, so we have full-time staff on site for newcomer services Monday to Friday. A lot of the drop-in conversations, like we have booked appointments as well, but the drop-in conversations that are happening are often related to concerns around that, or just checking in, like, hey, I received this, or this happened. Knowledge checking. So it's great to have, it's good to have people around who are able to support with that. It's interesting as our newcomer population sort of has risen. And I'm sure all of you see this as well. We've seen an increase in scams and in people trying to take advantage of our residents and our newcomers in general. Sad, really.
Yeah.
Thanks, Kathleen. We've already talked about the challenge of the lack of affordable housing, and we've already got a few things in place to help address that. Something simple is not being prepared for a Canadian winter. That's something that we're seeing this year and last year. As I mentioned, we've been open for about just over a year. So we've actually had a winter clothing drive amongst our YMCA staff. So all YMCA staff could donate gently used clothing items so that we have enough items on hand to provide to our new residents who have not had a Canadian winter yet. And I think probably one of the most challenging situations that we've been dealing with most recently is helping residents balance their family responsibilities, which usually involves sending a good chunk of any money they earn back home to build versus building a life for themselves here. So our case managers do work with the residents around their priorities, as well as with budgeting, as previously mentioned, so that they can still fulfill their family obligations by sending some money back home, but also making sure they can afford to pay their shelter contribution, which is a requirement in our transitional housing program. It's not a free service. They do have to pay for their stay here, but making sure they have the money to pay their shelter contribution for their basic needs, to try and save up for first and last month's rent to move out, but still being able to send some money back home. So that was something that we had to really think outside the box with that. And it was some difficult conversations for sure. I think those are the main challenges we've been seeing. And again, with the realistic solutions that we've come up with. I don't know if Liz or Kathleen, you have anything more to add?
Yeah. I mean, we've struggled with this shelter contribution piece a little bit. Just for a bit more context, a lot of our residents pay, it's what, $390 a month, which is the shelter portion of their Ontario Works, if they're on Ontario Works. So it's really quite affordable. But yeah, it's really hard if they've come from a shelter and they haven't had to pay anything, or if they do have a family back home they're supporting, it can be really challenging. But we also have to encourage residents to be thinking about saving up for first and last, which is the other monetary challenge for getting housing ready. So yeah, it's as Belinda says, it's taken some ongoing work on the part of the case managers to communicate these issues and make sure that the importance of those pieces are understood and acted on. The only other thing I would add in terms of challenges was, we think a lot about the mental health supports that our residents need. And I think it's fair to say across populations that have experienced homelessness or other forms of trauma, those needs are just growing, and it's difficult to access mental health care funding. But we are trying to, we have this nurse who's on site who connects people to programs. We have a partnership for the youth with the Royal Ottawa, which is a local mental health hospital. But I would like to seek some funding to have perhaps a permanent on-site mental health professional so that we can support our residents in that way. So those needs are definitely growing. Anything you'd want to add for challenges, Kathleen?
Not add. I just wanted to point to like what we were talking about in terms of sending money home. This is one of the great ways that our newcomer services team and our housing team have worked together. So, we're making sure that these are difficult conversations. We've been talking about how this is singles. The more accurate term is solos.
Yeah.
So these are individuals who are here on their own, with the ultimate goal often of bringing their families over eventually once their claim has been settled and they apply for permanent residency. So they're it's not that they are single, it's just that they've come to Canada on their own with the for a variety of reasons. So there are a lot of there's the need for balance, and the conversation around sending money home, it's not taken lightly. But what we do know is that there are financial obligations here that they need to we need to help them navigate, because in order to set up their new life here, they moving on from as lovely as our program is and as welcoming as the Y is, the ultimate goal is it's not to stay with us. We're trying to set them up for set our residents up for success, to move into market housing and to really start their lives here in Canada. So it's been difficult conversations, it's ongoing conversations, it's regular conversations, and it changes day to day because the needs are changing. So it's this has been a real come together between the two sides of the program to really support our residents.
That's it.
Yeah.
Yeah, and on that note, let's talk about some of the success stories and the aftercare component as well. Belinda, did you want to kick things off with our Newfoundland story?
Yeah, so we were approached by some representatives from the government of Newfoundland and Labrador late summer, I think in August. They had some employment opportunities in their province, and wanted to know if any of our residents would be open to transferring out to Newfoundland and Labrador. So in October, we had 17 residents who resettled in Newfoundland and Labrador. There was a flight out there for them and a couple of families who were also in the family shelter system, a chartered flight out to Newfoundland and Labrador. And we have since heard that a number of them have secured employment opportunities and are on their way to finding permanent housing. So that was a really great success. There's supposed to be another chartered flight coming up in early 2026.
Nice.
We know that a bunch of our residents were leery about moving, and when they heard from their friends who moved to Newfoundland and Labrador, they regretted not going with them. So we're hoping that another opportunity comes up. So that was definitely a success to work in partnership with the province of Newfoundland and Labrador. We've had a number of residents who either shared rooms here together or just knew each other from living in the Y, who've moved on to market rent housing by sharing an apartment, which is a great success right there, because we all know how not affordable it is for many people to live by themselves, even in a bachelor apartment. So most often they do find an affordable 2-bedroom apartment. They're usually working, but it's been really great. Happy to say none of those who've moved on from here in shared accommodations have returned. So I think that's good news right there. Some of our residents have actually found employment within the YMCA in other departments. So we have some residents working in our childcare team. So again, it's that's definitely a success. We know that they've got gainful employment and they're well on their way to move on from the YMCA as far as their housing piece anyway. Updates on statuses. A number of people have secured their permanent residency or whatever it may be. Again, another really good success, and shows to how well our teams work together on the settlement with the settlement journey for our residents. And I think that's probably the majority of the successes. I mean, I think, like I mentioned, we've only had this program open for about 13 months. It was a staggered opening as we were preparing the rooms and getting everything ready. So between October and January of this year, is when we move most people in. And we are finding that majority of people, again, we've just hit the 13-month mark, but the majority of people are able to get settled as far as employment and move on to housing within that 12-month period. So that's obviously very good news.
Nice.
As you were talking, Belinda, I was thinking of another couple of things. So I did want to mention, in terms of the newcomer services support, Belinda was mentioning that sometimes people's status changes because they are with us for several months. So obviously, one of the other things that our newcomer services team is able to support with is connecting with the settlement community to help with PR applications and that type of support. And then there was I've forgotten it now, but there was something else that I was going to mention. Liz, maybe if you want to
I'll keep
chat
going.
about
Yeah.
what you were going to say, and then it'll come to me.
Yeah, you pipe up. Okay.
Yeah.
So yeah, I just wanted to mention briefly the plans we have for aftercare, because when people leave any of our programs, we're interested in knowing how well they're doing, how well they're settling into their new homes and their lives. And so we're developing a kind of a program of aftercare where we touch base for 3 months, just to check in on them, make sure that they're connecting to services and supports, and developing also a client satisfaction survey that we're talking to other housing and homelessness providers about best practices on that front to make sure we're measuring things accurately and we can report on the evidence base after a certain amount of time. So just wanted to mention those pieces are in development. Anything tweak your memory, Kathleen, or we've just got the one more slide, so.
It was coming back to challenges. One of the things that we've been adapting is that we've had so much employment success. So many of our residents are working, sometimes multiple jobs. We've had to be flexible because our newcomer services support has been mostly sort of Monday to Friday, business hours. So that's something that we continue to navigate, making sure that workshops and those sorts of supports are available multiple times and at a variety of times during the day, so that we are accessible for those who are working during those core business hours.
Yeah, that's it. We've had to adapt. We definitely have. All right. I want to make sure we leave lots of time for discussion. This session is an hour and a quarter, just for those of you who weren't sure. So we'll go right up to the o'clock. So learning and evaluation, I just want to share a little bit about our data journey. We are developing a data dashboard for housing services at the Y in support of our new overall organizational strategic plan. So we're doing a lot of work in terms of our internal and external dashboards. The internal ones about things like occupancy rates and what are the demographics of people we serve. External ones will be things like, how quickly can we move people through their journey so that they move on to work and permanent housing. We've been doing a lot of work in terms of data quality. So HIFIS is the system that we use, which is all housing and homelessness providers use across Canada, I believe. It stands for the Homeless Individuals and Families Information System. So with that, we're kind of making sure that talks to our planned case management system, which is in transition from paper-based to electronic right now. We're helping staff understand the importance of data privacy, updating data consent forms and so on, and making sure that we align those pieces with our wraparound services so that we can, share data across departments and make sure that we're measuring the right things in terms of our overall approach to our residents' well-being. And we're developing a bit of a community of practice. This is just starting. Build Canada Homes is a big opportunity for housing providers in Canada right now. And so we're documenting our delivery model in terms of transitional housing and looking to benchmark what we do against other housing providers, both YMCAs and other housing providers. not only in terms of our, the rapid integration for newcomers, but also the quality of their experience, their social integration, those pieces. And we are exploring a partnership with an Ottawa U researcher whose work focuses on intergenerational social integration and kind of dismantling prejudice by having people more exposed to those with different backgrounds. So there's some exciting possibilities on that data front. And then in terms of areas for further learning, I think we've got work to do in terms of the measuring the importance of hyperlocal connections, like neighborhood connections, through the aftercare and follow-up survey piece. So how well are people being connected to the services in their neighborhoods once they leave the Y? I mentioned earlier the importance of mental health care for trauma survivors. We'd like to do more work on access to that kind of care and the outcomes that our residents experience. And then I think the piece that Belinda mentioned earlier about different factors that affect the speed of integration, whether it's the roommate connection, the cooking together, the type and location of permanent housing that they access after. So all these pieces are area for further learning and research, and we'd love to explore those as we continue on our learning journey. Anything that either of you would like to add on that piece, Belinda or Kathleen? All right. So with that, I'm going to close up the presentation part and hand things over to Yvonne to lead the discussion, if you don't mind.
Yes, hi. Thank you so much for your presentation. And it's wonderful to hear about all your work, all the diversity of programs. I liked some of the success stories as well. But I wanted to kind of ask you a kind of a bit of a softball question, but also really important is like, could you tell us some individual stories of housing and newcomer services have impacted people's lives? Because we don't get to see that as the public. We might read the headlines, we might see the policies, but like you work with the people one-on-one. So are there a couple of stories that really stand out to you, just so we have a sense of kind of the how impactful providing housing and these newcomer services are?
That's a great question. Belinda, I'm going to get you to lead that if you don't mind. Joy comes to mind, but I don't know who else you might want to
Yeah, I was
mention.
thinking of that too, but we also have a story of a mother and a son, actually. So the mother was referred to our transitional housing program, and she and her son were couch surfing. And the mom, and this is before we were receiving referrals from the community shelters. She ended up in the distancing center and was referred to us. But her son did not want to stay in the distancing center, and he's 19, I think he is. Anyway, so the mom came to us, and she was reluctant to move into the YMCA because she was worried about her son. They were both newcomers. We had spaces available in our second stage housing program for youth. So we connected with the staff team in second stage and were able to get the son housed within our program as well. Both of them are thriving. They're both doing really, really well. The son was more concerned about his mom. He didn't want to see her unhoused, so was encouraging her to move into the Y, but she wouldn't move into the Y unless he had a place to go. So we were able to keep them together in the same building, obviously in separate programs, but they're both doing really, really well. So I think that's one of our really good success stories. Yeah.
And thank you, but this is the human element of it,
Yeah.
right? And I
Yeah.
think sharing that is just
Yeah.
illuminates something so simple, which is that, people want to stay together, families want to stay
Yep.
together, and they can only really do that through services like this that see that,
Yeah.
right?
Yeah.
Mhm.
We also just touched briefly on another situation where we had a young man who was Canadian border CBSA. Um, there were issues with his paperwork. He had not filed his paperwork properly, and CBSA showed up here at the YMCA. They were wonderful. I just want to say they were wonderful and gave him an opportunity to get everything organized so that he could stay with us. And that's when our newcomer team stepped in and helped him get everything settled. And he now has status. He has a work permit, so he himself is doing really well too. But those are the kind of things that we see on a regular kind of basis. So it's hard for me to kind of pull a few examples out of my head, but yeah, that's the sort of stuff that we see. And for some, it's just success stories like, oh my gosh, I have a warm place to stay tonight. As simple as that is. I mean, nobody wants to be in the shelter system. Nobody wanted to be in a distancing center. So this is a place that they can call home for up to 12 months where they can work on their life skills, where they can find that sense of community, where they can, just thrive.
Thank you. And that leads me to my other question, which is kind of, what are some common misconceptions regarding housing services, especially when it comes to refugees?
Yeah, that's a good question. Shall I start off and you folks can
Sure.
add if there's
Yeah.
anything? Okay. So, I mean, the big one I think that our sector faces is that newcomers are taking all the housing away from everybody else, and that's why we have a housing crisis, right? So this to us is like the housing system is very complex, but that is an absolute oversimplification. And although we see immigration numbers going up and down, and we've seen a lot of changes on that front lately, but we've had a housing crisis that is much more longstanding than that. And our housing system needs all kinds of improvements, but we could look going back to the 1990s when the federal government pretty much stopped building nonprofit and cooperative housing, if we wanted to trace the roots of our housing crisis. So certainly there's ways we can improve the system and make sure that people are finding the right housing. So there's system navigation pieces in housing and homelessness services, and we need to make sure we're providing the right housing for newcomers who do arrive and are struggling. But we can't trace the source of our housing crisis to immigration in the way that some people suggest.
Anything to add, Belinda or Kathleen?
I would also, in terms of the supports that are available in the community, this program was developed because there was a need in the community for a specific approach tailored to a newcomer population. Belinda spoke a little bit about this in terms of where our residents were coming from. But in the Ottawa area, there was, what year was it that the housing crisis was actually
Declared 2020.
Declared 2020. So
2020.
going back, 5 years now, there was a declared housing crisis in Ottawa, and the traditional approach that had previously been meeting the community needs was no longer working. And so the city, in collaboration with the province and the federal government, because at that time we had the IRCC funded hotels, was sort of navigating what the next step was and how to support this population longer term and in a more stable way. So and I think it was a thoughtful approach and is an example of how this can really work, because we know that the needs, the unhoused newcomers have different needs than other populations, and so it needed a different approach. It's not that there isn't support available to all homeless populations or the population at large, but that this was a different approach that was needed because the needs are different.
Okay, great. We're getting some questions, and hopefully Liz can do the Q&A in a second. So my last question is really kind of building on this. Could you just take a step back and just walk us briefly over the roles and responsibilities each level of government, just so that we're clear as to what the responsibilities are in terms of housing and in terms of refugees, and then them coming together? I think it would help some people in the audience wrap their heads around it.
Mm-hmm. For sure. So our funding agreements are with the City of Ottawa. Those agreements reflect provisions that show that the money is flowing from the federal government and the provincial government. But for this particular program, for the transitional housing program for individual newcomers, it's federal funding, and so the city's actually reasonably flexible as a funder compared to other levels of government, but it is federal funding. There's a lot of responsibilities that fall to the federal government when it comes to housing, but the province's role has varied over time. Certainly with our current situation, we haven't necessarily seen a rise in response in terms of housing policies that would meet the challenge of the housing crises that municipalities are facing. So I think there's public policy work to be done there. And then in terms of the municipal role, obviously municipalities have responsibility for the actual frontline service delivery. So the partnerships with nonprofits in terms of housing and homelessness services, they also have a big impact in terms of what the housing market looks like. So zoning provisions and development charges and that kind of thing. So housing is actually quite a complex multi-leveled piece. Of course, the province regulates the landlord-tenant relationships. So there's a lot of pieces that are affected by all levels of government in terms of their decision making. There's pieces that relate to newcomers in particular. I don't know, Kathleen, if you wanted to address that, but we could go into more how the city of Ottawa has handled the situation in terms of their newcomer reception response, if that would be helpful. But I don't know if you want me to go down that road or address the other questions that have come up.
Maybe answer that, and then we can
Sure.
transition to the Q&A questions.
Okay, for sure. So Kathleen alluded to this process before, where in the city of Ottawa we have I think the city has been fairly good at trying to get out ahead of the challenges and to work with the nonprofit sector in terms of developing a coordinated response. So a couple of key tables come to mind. One is the Alliance to End Homelessness Ottawa, which has done a lot of the pieces around navigation, system navigation, and advocacy for homeless people writ large. But then there's this new table, the CIRC table, collective impact. Oh, help me out here. Collective impact, something for refugee claimants. Is that a table? Initiative, that's it. Collective Impact Initiative for Refugee Claimant Table. And that's led by Refugee 613 here in Ottawa. And that's a table where we can come together and talk about the challenges of system navigation. What does the system need to look like in terms of serving newcomers? And they recently won a city RFP to do some system design work, some co-design with the city and with all of us as CIRC table members to figure out what does that reception system need to look like. Some of you may have heard about the sprung structure debate that happened kind of 6-12 months ago in Ottawa, where there was a proposal to have a sort of semi-permanent structure where newcomers would be channeled when they first land. The city backed away from that, and so now we're all thinking, what makes sense in the context of services that already exist on the ground. So, we welcome newcomers here into our transitional housing program. There's one other larger provider and several small ones in Ottawa. And how do we make sure that all the people served in that system are served in an integrated way? And so the city and the CIRC table have been really important partners in terms of developing that piece in the context of the federal dollars coming down and the need for system coordination at the local level. So definitely want to mention that piece. Shall we move along to the written questions we have? Okay.
Sure.
Yeah.
All right. So primary funder, City of Ottawa, yes. Do we receive IHAP funding through IRCC? So our IHAP funding, and the answer is yes, it comes through our city agreement. So it's an indirect relationship.
Yeah, so we don't receive it, the city receives it.
Yeah. And then how do how long do asylum seekers stay in supportive housing on average? So Belinda, you probably have the best sense of that, in terms of what's the turnaround?
Yeah, I would say we're seeing probably 8 to 10 months at this point. Again, we've only had our program up and running for 13 months, so we don't have a really full picture yet, but I would say roughly 8 to 10 months for those who have been here for that length of time, yeah.
Right. Thank you. And then the last one, can you please elaborate on available healthcare for asylum seekers? Yes, so certainly we have a great partnership with the Centretown Community Health Centre, and they send a nurse to visit, and the nurse meets with any residents who want to meet with that person and can refer to other programs. We have the vaccine clinics. I think we've done 2, like one each fall.
Yep.
Right. So those have been COVID and flu shots, that kind of thing. And then anything else, I would say, and correct me if I'm wrong, Belinda, comes through the community Centertown Community Health Center in terms of accessing healthcare services. I mentioned, the mental health support piece is it's not direct for transitional housing, but we do have this relationship with the Royal Ottawa that we would like to build on. Belinda, what do we do in terms of other mental health supports? Is it referral based?
We've had referrals to CMHA, Canadian Mental Health Association, is the primary one, I would say, at this point. Yeah.
Right, that's it.
And then there are also the supports that are available to newcomers specifically. So there's one-time access to counseling, and then sliding scale access beyond that, specifically for newcomers in the community that our newcomer team also helps connect with. Right. In terms of the other available healthcare, obviously, as refugee claimants, they have the residents have access to the interim federal health program, and which is where the Centertown Community Health Center comes in, because that's an eligible service. We also have the Ottawa Newcomer Health Center, which is right nearby. So there are lots of access points. One of the great things about our location is that there are, being centrally located, those supports are in the community and are easily accessed.
That's it, yeah.
I would, in terms of the healthcare support, one of the great things about our transitional housing program is that we are set up to help. We are able to support and able to provide like not quarantine, what's the word I'm looking for, Belinda?
Isolation.
Yeah.
If someone needs to be isolated. Yeah.
For some of our individuals who have greater health concerns.
Yeah.
And that's one of the reasons that they've been placed in our transitional housing, or in our programs, is that we're able to support that. And maybe Belinda, you could talk about that just briefly.
Yeah, when we obviously we all lived through a pandemic recently. So one thing we learned is in a congregate setting, you need to have a space where somebody can isolate if they have a roommate or whatever it may be. So when we transitioned to our singles program, we made one room for females and one room for males, isolation rooms. So if we ever had an outbreak of anything, there would be a safe space. And in that space, it contains a refrigerator, a private bathroom, and a microwave. So minimal contact would be needed with anybody else. They could isolate in that room as needed. We do currently have somebody, because they're having some health challenges, currently staying in one of the isolation rooms because they need to be kind of separated from the rest of the community right now. But that's definitely been a saving piece for us, I would say. We didn't have to go back and think, what are we going to do? We already had it in place. So.
All right. Any other questions that are coming in? I know we've got.
Well, I was actually,
yeah.
I was going to ask you, and please, yes, please put more questions in the chat in the Q&A. But I was going to ask you, could you guys perhaps give like a more comprehensive timeline of what someone's experience might be? Putting in a refugee claim and then putting a claim for or a request for this housing and the various services. You can give us a story of somebody, or just so people can appreciate how long or short they might use these services and what the potential outcomes are.
Yeah, no, that's
useful to touch on the reality of what we've seen and then the ultimate vision, right?
That's a good way to put it. Yeah. Our funding specifies that we are expected to turn people around in 12 months. We're working on getting that timeline down for sure. But the housing availability is certainly a factor. I think it's realistic, would you say, Belinda, to have people moving along in 6 to 9 months unless they face particular barriers?
Yeah, I think so. And like I said, the average seems to be right now between 8 and 10 months, as we're still getting everything sorted out. But oftentimes, because we are not the immediate point of entry for a lot of the residents, they come through the community shelter system. We don't know necessarily how long they have been in Canada or in that shelter until they arrive to us. So sometimes they may have been in Ottawa for 3 days. It could have been 3 months. It could have been 6 months. It could have been a year. So everyone's journey is different, of course, but once they hit our doors, that's when we work with them in trying to move them on within well, ideally 6 to 9 months, but up to 12 months.
That's it. So yeah, so we're working on that timeline, and in fact, HIFIS, the data management system that I mentioned earlier, is introducing, well, the City of Ottawa is piloting, I think, in conjunction with HIFIS, a module that actually helps to track the asylum claimant journey. There's an individual's component and a family's component, so that we can actually better identify what the blockages are in that journey. So, for example, is it someone still waiting on paperwork? Is it that someone hasn't yet found a job? Is it, that they're not spending enough time doing housing search? So we can actually figure out why it's taking as long as it might, and then be able to address those blockages, as it were, in the journey. So I think having that data will be really helpful.
A lot of the residents who came to us initially were coming from these physical distancing centers, and so much like their portal, they were well along in their claim, but hadn't necessarily received any of the, other than the logistical legal things that needed to happen, there hadn't been any other support that we know that so many newcomers need. So that's been, so that the supports have been tailored to that population initially, but the ideal would be ultimately that there isn't that blockage on the front end, and that people are coming and receiving the support earlier on in the process, and therefore able to move more quickly through. Like, obviously the wait time on the hearing is going to be what it is, like that's out of our control, but so many other supports and life stabilizing supports can be in place so much earlier in this type of with this type of program.
And may I ask a follow-up question? Because I think some people, I mean, I was surprised it was short. I mean, 8 to 9 months seems quite short in terms of them having this housing. And I think a common misconception people might have is that once they get these services, they want to be on these services for as long as they could, right? Because it's free, or most of it's free. That's some of the misconceptions that you see on social media. So could you elaborate on the reasons why people might not want to be on services, or not want to be feeling like they need this help, right? Because I think that is a lot of what happens. They come here, they have these challenges initially, but they really do want to, they're upstarts. They want to kind of get going and create their own way. So can you elaborate on that a bit?
I mean, I think we've noticed that, Belinda, that the people who enter our transitional housing program are motivated, and
Absolutely.
they want to get on with their lives, get on and find work. As these are the people who made it as far as they did because perhaps they were particularly resourceful and driven. And so we have found generally people in our transitional housing program are happy to do what it takes to take the steps they need to become housing ready and get on with their lives. And, as came up early, many of them do have families at home that they may want to sponsor down the road. So just accelerating that process, it reduces the time they are away from their family. So that's been our experience, I would say, so far.
Yeah.
And to be honest, one of the reasons we went double occupancy, because our previous transitional housing programs and supportive housing programs are one person to a room. And I think we wanted to make sure that people felt welcomed and comfortable, but not too comfortable. So there's a benefit to moving out and onto permanent housing, generally that they would have more privacy and so on, their own kitchen instead of a shared kitchen and so on. So I think we tried to find that balance in terms of being comfortable, but there's still a motivation to move on to the next step. Yeah. Oh, we've got a new question. That's great. I know you mentioned partnering with employment services, but have you partnered with any individual employers? Have you done any employer engagement to encourage labor force integration of asylum seekers? That's a good question. Who wants to handle that one?
You want me to handle that?
Sure. Thank you.
So, absolutely, we have. We're at the beginning of this program, we actually had a dedicated employment Ontario staff on site to support access to the labor market. Interestingly, we found and ultimately didn't keep that model. This was one of our early learnings, was that many of our residents were employed. And so that although we do maintain employment service support, we have a really good partnership both with local Employment Ontario sites, but also with Ottawa has a dedicated employment center for newcomers called World Skills. We have really good relationships with them and collaborate with them on a lot of things. We have those programs on a, I want to say, weekly basis, have hiring sessions and employer events. Really, our employment services at the Y has a very robust employer relations, employer liaison team. I think at this point we have somewhere between 15 and 20 employer liaisons whose job is to go out and build relationships with a variety of employers and create opportunities for our clients. We make sure that anyone who is not currently employed is connected with a case manager with one of the employment programs. If they're not already connected, then we'll connect them with our Y Employment Access Center, which is an Employment Ontario site. If they are already connected with an Employment Ontario service provider, we make sure that we are connecting with their case manager at that location to really advocate for the need for support and make sure that they're getting the wraparound support that they need in order to find employment. But the Y team, our Y Employment Services, is really good at doing that. So long story short, yes. To it all. Yeah.
Thank you so much, Kathleen. And with that, we've been asked by the conference organizers to wrap things up. So I'll say thank you to folks as Belinda and Kathleen. If you could put your email in the chat, that would be great. Thanks, Belinda. And thank you so much to Yvonne for being our discussant today. Really appreciated having you on the conversation. And thank you to everyone who joined today. If you're interested in hearing more, we'll certainly post our slides on the conference portal, and feel free to follow up if you have more questions. So thank you so much, everyone. Have a great afternoon.
Thank you for your great work.
Thank you so much.
Keep it up.
Thank you. Take care, everyone. Bye-bye.
Bye-bye.
Bye.